feel like what came through from the women was that they're thinking about what the future might hold. They want to talk about it. They want open and honest communication. That for the most part, providers recognize that this is something that's on women's minds, that it's hard to talk about. And one of the things that really came through for me was an education opportunity. If this is something that women are saying is important and the providers have it on their radar, and yet it's hard. And that there's an opportunity there for education and support for providers to have these conversations, and all categories of providers are having them. So I think we hear a lot of times, or the research has to do with the oncology physician, but the nurses, the nurse practitioners, the physician assistants, the patients are asking them too. Sometimes right after asking the doctors, they're telling us the patients, sometimes they spend more time with the nurses and the nurse practitioners, physician assistants, and they have these strong relationships, and they're having these conversations too. So recognizing the important role that the non-physician providers are playing in these conversations, and so targeting the education to all categories of providers, that women are having these conversations with their nurses, with their nurse practitioners, and that I think we have a obligation to all of those provider groups to help them acquire the skill set to do it well.